Hello everyone and welcome to this new special edition of Surfing the Internet. In this lecture we will be surfing the internet for something very important, and it will be dentistry and education. Dentistry and education is very important subjects in this day and age. Education for dentists or students, schools require applications to have completed certain science courses such as biology and chemistry before entering dental school. Students typically need at least a bachelor's degree to enter most dental programs, although no specific major is required. In this episode, we will be surfing the internet, looking for what is important in the internet. We might find important things that we will be discussing. So let's go and see here the first link.
Here we have the first dentistry education requirement centered around career information. We have a video here showing us some serious things.
And we can read here essential information. A dentist provides oral health service to adults and children.
Some dentists choose to study a subspecialty such as orthodontists. Most dentists obtain an undergraduate degree. So basically, such orthodontics, most dentists obtain an undergraduate degree before completing a 4-year dental program and earning doctoral degree in dental medicine or dental surgery. While no specific undergraduate degree is required, students commonly take science courses in biology, anatomy, chemistry, and microbiology. Postgraduate requirements such as residency may also be required. All dentists must be licensed by the state in which they are practiced. Required education, bachelor's degree prior to admission to dental school, doctoral degree in dental medicine or dental surgery, some dental specifications, and licensing and projected job growth is 7%. Median salary is $100,000. Dental school. And by the way, we will be testing some voices to change the audience and experience for education and entertainment. Dental school enroll in a dental school. Enroll in a dental school accredited by the American Dental Association. This website is not bad. It's all talking about some stuff about dentistry. And it's a good opportunity to change voices and tests. Which one we will be liking in the next website we'll be visiting. Night. DDS degree. DDS degree covers 4 years in class, pre-clinical and clinical introduction. The first 2 years are devoted to lab and class instruction. Courses may include oral pathology, dental diagnosis, and dental treatment techniques. In the last 2 years, students typically complete a dental rotation exercise, which is usually conducted in the dental clinics and allows students to treat patients under supervision. In addition to general dentistry, dental schools typically offer specialized areas of study, such as oral and maxillofacial surgery, orthodontics, pediatric dentistry, and we have the career information, employment outcome, salary information. And I think this is not educational at all, and therefore we will be going to another practice, or should I say another website. Let us go to the next website here, Dentist Education Requirements and Career Information. I don't think so. Let's say dentistry endodontics. Endodontics is the branch of dentistry concerning dental pulp and tissues surrounding the roots of a tooth. Endo in Greek, word for inside, and odont in Greek for tooth. Endodontic treatment or root canal treatment treats the soft pulp tissue inside the tissue. Let's stop these voices. Maybe we have added some, and now we have removed all desired voices. Therefore, we can enjoy this website that will give us information about endodontics. So endodontics is, what is endodontics? We have some paragraph here talking about endodontics. And to zoom in, we have to Control plus to zoom inside and to watch the words very clearly. Endodontics is a branch of dentistry concerned dental pulp and tissue surrounding the roots of the tooth. Endo in Greek for inside and odont in Greek for tooth. Endodontic treatment or root canal treatment treats the soft pulp tissue inside the tooth, and endodontics is the dentists who specialize in saving teeth. I hope you understood this, what I have just said, because I sometimes, because of the mic and because of the audio interference and because of the non-native language of mine, sometimes you don't understand some words. Generally speaking, I will give a basic idea about this. There is a guy or a specialty or a specialist called endodontists, and also there is a endodontic treatment, and it's concerned with root treatment of the teeth. Endodontists become specialized by completing 2 or more years of advanced training in endodontics following dental school. They perform routine as well as difficult and very complex endodontic procedures, including root canal treatment, endodontic surgery, and special procedures to save teeth after dental injuries. After traumatic dental injuries, by focusing their practice on specific procedures such as root canal treatment, surgery, and trauma, endodontics are experts at managing a wide array of complex endodontic problems efficiently. Advanced technologies and specialized techniques used by endodontics give them a very accurate view of the inside of the tooth and allow them to treat the tooth quickly and comfortably. Here we can see that the endodontist is the guy and the specialist that treats some patients that's having very difficult problems, and of course we surf the internet looking for such difficult problems and how to solve them. By saving your tooth, an endodontist can help you keep your natural smile, so you can continue to eat your favorite foods and maintain your overall health. Nothing looks, feels, or functions like your natural tooth. For more information about tooth canal and other treatment, visit the patients section of the Dental American Association of Endodontic, which also include information addressing common myths about these tooth saving procedures. Here we can see that this website is very important to understand. It's called mouthhealth.org/en. This is not slash, it is backspace or something like that. Actually, it is a slash az-topics/e/e/endodontics hashtag dot semicolon and hyphen text equals dentodontics percentage 20 is 20, etc. We are not going to read the whole thing here because it's very long, but to give a general idea, this is a mouth health organization of ADA. It's approved, by the way, and we are surfing the internet, providing you the best and the latest information about endodontics. We have life stage here, and includes pregnancy, teens, adults. We have IDA serval and AZ topics, etc. Okay, great. So we have searched in the search bar in the Bing Microsoft. Unfortunately, we cannot change Bing to Google search because Bing is controlling Google. Microsoft Bing is controlling Microsoft Edge. That is the browser that we are using right now. Therefore, we'll continue with Bing and let's see here. Endodontic Medical Association, root canal treatment with symptoms. Let's go for this one, please. And this one is all about the coronavirus scheduled and vaccination. Anyways, let's go and read some of these paragraphs. Just for you, for your education and entertainment, we will be continuing such lectures. Endodontics, a severe toothache can take over your life. Highly trained endodontics, dental specialists repair tissue inside the tooth in interactive ways. Intricate ways. They diagnose and treat complex causes of tooth pain, such as tooth abscesses. Endodontics perform tooth canal treatments and other procedures to relieve pain. They work to save your natural teeth. Here we can see another paragraph talking about an endodontist, which is how trained personal focuses, caring, and etc. What is the pulp? Tooth pulp is what dentals provides cold nerves, blood vessels, and other tissues deep inside each tooth. When you look in the mirror, the part of your teeth that you see is an outer layer called enamel. The pulp or connective tissue inside teeth plays an important role in helping children's teeth develop as they grow. I will not give you any indication or any information about this and the decay, the pulpitis, because it's very clear. How does an endodontist compare to a dentist? All endodontists are dentists, but less than 3% of dentists have done the extra training to become endodontists. By the way, I have not done the extra training yet. I just do simple dentistry like filling, like extracting teeth, etc. After dental school, an endodontist complete at least 2 or more years of focused training. During this time, endodontists focus on techniques to diagnose and treat tooth pain that affect tissues inside pulp or around, so that here we can say that the endodontist can continue his education and he's more specialized than dentists. What does an endodontist do? They are sometimes called canal dentists, which general dentists are. Endodontists can both perform root canal treatment. Endodontists perform this procedure much more often. This higher volume and additional training translate to an endodontist's higher level of experience performing root canal treatments. Additional training and high-level experience is performed on endodontists specialized in diagnosis and complex causes of tooth pain. They are performed. Other dental surgeries include endodontic treatment, emergency, removes, replaces material such as during a provided tooth that is not proper. Emergency also something they do most of the time. And surgery also, we can see here. Dental implant surgery, Endodontists specialize in diagnosing complex pain. They also perform dental surgeries. I guess the endodontic can also do tooth extraction, dental implant, endodontic surgery, and it's very strange that the endodontic is not only specialized in endodontic procedure, but also can do emergency dental treatment, tooth extraction, dental implant, and endodontic surgery. I think most of viewers of this episode are from the dental field, therefore they know what we are talking about, and there is no need to explain and go in depth of how the basics works. What do endodontists treat? Endodontists primarily treat tooth pulps, anterior teeth, or tooth tissue that have undergone damage for some of the following cases. Tooth decay, such as untreated cavity for pulp, plaque that damage tooth tissue, tooth abscesses, and tooth injuries. And we know what is tooth pus or abscess is. We know also what tooth injury from trauma, cracked tooth, etc. What does the endodontist test for a tooth? What is a root canal? How does a root canal be performed? I think here is the most important information, because the next what we will be reading is how the endodontic procedure is done, and we want to give a good look for the viewers and you, of course, the viewer, the most important information for your time, and to give you a very basic understanding of the subject. What can I expect after endodontic procedure? What should I call an endodontist? And more about this subject. And this is what I like about such important websites. They give a lot of information that is helpful, and therefore we should read them and understand the most important subjects that they offer. And there later we should go to other websites connecting to such a website and read more. For now, what is the root canal performed? Or how is the root canal performed? Endodontists use an operating microscope and sophisticated tools to repair tissue inside the tooth. During tooth canal surgery, you lie on your back in a comfortable chair. You receive local anesthetic to numb the inside of your mouth for your comfort. During root canal treatment, your endodontist places a dental dam, a tiny trap over your tooth to isolate the affected area and protect your mouth, such as from infection. Also, access the pulp tissue from the top or behind your affected tooth. Removes damaged or diseased pulp tissue, cleans and disinfects the area inside the tooth, fills and seals the tooth. This is so much basic of how and what the endodontists do. Therefore, we should focus on more in-depth procedures, endodontic procedures. This is what we will be searching for. Hopefully this time this website will give us something more understandable that we can relate to, and the dentists and dental students will have much benefits. Endodontic procedure and benefits from this website, Endodontics American Association, as you can see here. So, posted in Patient News, November 9th, 2017. You wouldn't take a car in for repairs or have work done on your home without understanding the problem and how it would be fixed. It's even more important to know and understand your treatment option when it comes to your teeth. Sometimes you use every day to cut and chew your food. Today, there are many treatment options for repairing and damaged tooth, so it's vital to weigh your options and how they will impact your future dental health and lifestyle. This is also marketed for dental patients and not for dental specialists, unfortunately. So this website is also not very beneficial to us. Let's go for like endodontic procedures in depth. Let's say the first, please web your website. Is checking that you are not a robot. Please check with image, continue with a bus. Next. Containing a bus. Please check containing a boss, and the robot will be happy now. Unfortunately, I think such websites will give robots a very smart advantage above the human and will make our life very tough in the future. Regardless, it is redirecting and giving us the website that we are looking for common endodontic procedure from Dr. Paul Hafkar. This website, as you can see here, Paul Hafkar, dmd.com. We can zoom in here. We can see 4 common endodontic procedures. Endodontic procedures are not a type of dentistry that everyone will need. However, if you have several decades or damaged your teeth, problem lead to visits, root canal, treatment, surgery, implant. This is also not a serious website for dentists, but it can be provided for dental patients. Let's go here and search for endodontic treatment step by step. Hopefully this time this will give us more information or at least something to hold on. If this does not work, we should go and read a book of the cusp, dental industry news, trends, and information from Patterson Dentistry. This one coming from offthecup.com. 7 steps of endodontics. Fortunately, endodontics is a dental specialty which concerns the study of treatment of dental pulp in an area of dentistry that has been tremendous growth over the last 20 years. Unfortunately, however, this practice specialty is often still overlooked or dismissed. This can largely be attributed to a lack of understanding which breeds confusion and fear. Step 1, diagnosis. Most important aspect of performing an endodontic procedure is to first correctly diagnose the tooth. There are several tools to help you understand just what's going on with the patient's tooth. Radiographs, percussion tests, pulp tests, and endo sprays. Step 2, access. The next step is access, or creating an opening in the tooth's pulp. So after we diagnosed and tested the tooth, we now go ahead and access the tooth. Opening the tooth pulp chamber. This is achieved by using an endodontic burrs, hand rotator firms, restaurant, and chelating agents. Step 3, extirpation. Extirpation, removing the pulp and nerves in the tooth. This must often completed through the use of barbed approaches, but clinicians often use hand files or burrs to aid them when they deem it necessary. And this, I can say, is a very good website for dental students, not only for dental patients. Here we can have the 4th and main stage that given us an important subject that we will later go ahead and search for in the search bar and view such subjects in more details. Debridement, step 4. Step 4 is debridement or thorough cleaning of the canal. This step is done through the use of irrigants and chemicals such as EDTA and chelating agents. Hand files may also be used in this step. Many doctors like to flush the canal with the sodium hypochlorhydrins to disinfect and remove any lingering bacteria from the canal. So long as the canal is cleaned completely, no method is more correct than other. Everything is personal preference. This may be a good time to take another radiograph or measurements. To confirm the length of canal, you should use a traditional X-ray machine and place a handle file in the canal and mark the length. You could also use an apex locator to confirm working length at this time. Step 5, as we can see here, this is the next section of the root canal procedure, includes drying so that you can then move on the obturation and restoring the tooth to its natural appearance. Drying the canal is exactly that, drying the canal with a paper point. This is an important step both to ensure that the area can be sealed successfully and to inhibit bacterial growth once the canal is completely dry. And this step is part of drying, and people dry the canal with paper points. Paper points is like a tissue or a handkerchief to aid the dentists drain and clean and dry the pulp. The last step is obturation. As with many of the other steps, filling or obturation the canal can be achieved with a wide variety of methods. This includes root canal sealer, gutta-percha points, heated gutta-percha guns or system pluggers, and spreaders. Pluggers may require the use of heating elements. Sometimes the clinician prefer using gutta-percha product that has a solid core with a gutta-percha around it. Let me read this very slowly, and we'll come back to you later to explain it more. Okay, so I think I understand it. It's consisting of gutta-percha. What is gutta-percha? And what is spreaders, pluggers? These are the dentists that use them to seal the tooth and fill it in with heat. Of course, the gutta-percha will be cut. Lastly, it is time to restore the tooth. Depending on the patient and plane, temporary crown and bridge material may need to be placed in the tooth for a short time. This temporary may be placed for many reasons. If this is part of the 2-visit procedure, if the patient has to return to their general practitioner, or if they need to post. Posts are used to help anchor core build up material and crown. If the patients require crown, not every patient requires crown. So as compromise, filling over the root canal procedure may be the final step to restoring the tooth. So some dentists can do 1 visit endodontics, and some do it in 2 visits, as we can see from this website. But I think it is not possible, even from 2 visits, to do it, especially for beginners. Did this 7-step format help clarify the various important of an endodontics procedure? Let us know in the comments below if you are interested in reading more. Step by step, which outline products, 8 products, root canal. Okay, I pressed on this link. Let's see what's going on here. March tooth 8 procedures are the roots of the canal. Toothpicks. March, many melting bird chipping. This is very interesting, but I am not interested in such website. So we understand 6 steps in root canal treatment. Let's go in depth, because searching only endodontics will give us a general view of what is going on. But this time we will go and search for diagnosis. Or maybe we can say that diagnosis. And of course, this endodontic, this lecture or this important lecture will be finished soon. So please focus with us so that you can understand the remaining of it. Diagnosis of endodontic specialists. I hope this time they will give us something important. Endodontic or endodontic specialists are especially trained. Okay, I'm sorry. I will not write specialist diagnosis in an overview. Diagnosis in an overview. Science of identifying the disease of distinguishing by carefully signing what is endodontics. Endodontics diagnosis. I guess we will never have something in depth until we write something like research paper. Maybe now they will give us something more in depth. Clinical diagnosis in endodontics. This one, I think it's important. An investigation into different diagnoses of pulp and periapical pain. Then we have the diagnosis of selected pulpal pathosis using an expert computer system. 1998. I don't know how to access the text from this. It says here like it has been cited 10 citations, and give us an overview here. The diagnosis of dental pain, the result from the pulpal pathosis may prove to be confusing and complex issue for both dental students and experienced clinicians alike. A computerized diagnosis expert system was developed to aid in clinical diagnosis of pulpal pathosis and to provide a rapid, accurate second opinion on a human consultant is not readily available. The vast majority of diagnosis expert system use a single reasoning method as their interference mechanism expand complex prototype hybrid combination statistic. The comments in the dental procedure tested determine vitality, etc. A view on PubMed. Okay, let's go there. Launch research feed is also another option. Let's view it first on PubMed. This is PubMed, diagnosis of the thing, similar articles. This is an abstract. I only see the abstract, the summary, but I cannot access the full text. Let's see here. Recommended research. More of this. There are many researches here, as you can see. Let's go for one. Diagnosis of selected. Again, we cannot access the full text, unfortunately. There is a PDF here. The development of decision support system for diagnosis of chronic idiopathic facial pain, PDF. We can see here that the development of decision of support for the diagnosis of clinical facial pain. discover.uk.ac.uk.ucl, same to library, clear site, research feed. View all 85 figures and tablets. I think this is the research. It looks very important research. Let's go ahead and open one and see if we can make sense. Attend mu muscle sum less than 0. I don't know if this is a programming language or what, but this looks very complicated. So we have something very complicated and we have something very simple. We have research today. We need something in between, something that is intermediate. Let's see here. Diagnosis in endodontics books or PDF. Let's see PDF. Maybe PDF will give us some information here. We have 6 pages about endodontics. This web article, historically having been verified, examination, diagnosed terminology, reversible papyrus. Okay, I think this is intermediate. I'm not sure though. Let's see here, ACC, which is the difficulty. And this newsletter is designed to aid dentists, practitioners to use their best professional judgment, taking into account the needs for each individual patient to make diagnosis, treatment plan, and ACC, AAC. This writing is not very clear though. Even when zooming in, it has not been an enjoyable experiment here, but we will read it regardless. I hope you can read it with me because the text is not very well written. Endodontics colleagues for excellence. Historically, here have been a variety of diagnosis classification system advantages for determining endodontics disease. One, unfortunately, the majority have been based on histopathological findings rather than clinical findings, often leading to confusion, misleading terminology, and incorrect diagnosis. A key purpose of establishing a proper purple made, then improper management may result. This could include performing endodontic treatment when it's not needed, or provided no treatment or some other therapy when root canal treatment is truly indicated. Another important proposal of establishing a universal classification system is to allow for communication between educator, clinical, and students and researchers. A simple and practical system which uses terms related to clinical findings is essential. That will help clinicians understand the progressive nature of pulp and periapical disease, directing them to the most appropriate treatment approach for each condition. As we understand here, that there must be communication between the dentists and the systematic approach to classify and identify such diseases. In 2008, the American Association of Endodontists held a consensus conference to standardize diagnosis terms used in endodontists. The goals were to propose universal recommendations regarding endodontic diagnosis, develop a standardized definition of key diagnosis terms that will be generally accepted by endodontists, educational tests, consultations, experts, third parties, generalists, and other specialties, and students resolve concern about tests and interpreting of results and determining the radiographic criteria, objective test results, and clinical criteria needed to validate the diagnostic terms established at the conference. Both the AAC and the American Board of Endodontists have accepted the terms and recommendations. Their usage across all dental disciplines and healthcare professionals 5, 6, 7, each of the following diagnostic terms will be defined with typical respective clinical and radiographic characteristics, along with the representative case and progressive, and as such signs and symptoms will vary depending on the stage of the disease and the patient states. Coupled with this are the immunosualization or the limitations associated with the current pulp testing modulations, as well as clinical as radiographic examination techniques in order to render proper treatment. Complete endodontic diagnosis must include both pulpal and periapical diagnosis for each of tooth evaluation. Here we can see and understand that this endodontic excellence, endodontic college for excellence. This is actually coming from the American Association of Endodontics, published in professional community. This was an introduction of what's going to face us in this lecture, or in this PDF, I can say. Very boring, very interesting, but boring and pulp. Generally, I don't like reading things. I like visual entertainment. But this is not entertaining at all, regardless of whether it is entertainment or not. We will be studying it because we are dentists after all, and this is our specialty from birth to death. Examination and dentists and diagnostic procedures. Endodontic diagnosis similar to jigsaw puzzle. Okay, this is very entertaining. Endodontic diagnosis similar to jigsaw puzzle. Diagnosis cannot be made from a single isolated piece of information. The clinician must systematically gather all of the necessary information to make probable diagnosis when taking the medical and dental history. The clinician should already be formulating in his or her mind a preliminary but logical diagnosis, especially if there is a chief complaint. The clinical and radiographic examination is radiographic examination in combination with the thorough periodontal evaluation and clinical testing. Pulp and periapical tests are then used to confirm the preliminary diagnosis. In some cases, the clinician and radiographic examination are inconclusive or give conflicting results, and as a result, definitive pulp and pulpal diagnosis cannot be made. It is also important to recognize that treatment should not be rendered without a diagnosis, and in this situation, the patient may have to wait and recessed at a later date, or be referred to an endodontist. Let's continue. Diagnostic terminology approved by American Association of Endodontists and the American Board of Endodontists. Here we have a chart talking about examination procedures required to make an endodontic diagnostics, medical, dental history, past, recent treatment drugs, chief complaint, how long symptoms, duration of pain, clinical examination, clinical testing, help testing, diagnostic technology. Let's agree on one thing here. This is so boring and I cannot finish this. If I have an information, I will say it and put it and give it in a montage video. I will make a montage, I will make a video about it. But this, it's for like maxillary left first molar was endodontically treated more than 10 years ago. The patient is complaining of pain and biting over the past 3 years. There appear to be a periapical. There is it's not even systematic. Anyways, thank you for joining this important lecture. It was very fun and we understood many things. We made some surfing on the internet. Next time there will not be such surfing and reading random things on the internet, but actually there will be something very systemic. We might read a lecture, a lecture from the school or a lecture from a book. We will give you, and such surfing and looking for random things on the internet is really hard because it needs many clicking, many scrolling down and up and looking for the important information. We might not find it. Therefore, we should return to our basic formula of systemic reading of some books about dentistry or about medicine. Thank you for joining this lecture. I hope you understood and learned something new. Don't forget to like and subscribe to this channel and see you in the next one.